You're listening to an IOE podcast.
Powered by UCL Minds.
This is Research for the Real World. Conversations with researchers about the paths they've taken to shape our everyday lives.
This is Research for the Real World, conversations with researchers about the paths they've taken to help shape everyday lives. Hello, I'm Dr. Marta Francesconi. I am a lecturer based in the IOE's Department of Psychology and Human Development. I am mainly interested in researching factors that are predictive of mental health problems in children and adolescents. In this season of Research for the Real World, it's all about mental health. We'll be hearing from researchers whose work encompasses diverse areas such as eating disorders, behavior, and sleep. Today, we are taking a closer look at humanitarian emergencies and the impact it has on well-being. So I am delighted to have both Dr. Mukdarut Bangpan and Dr. Kelly Dickson in the studio. Dr. Mukdarut Bangpan is Associate Professor in Evidence-Informed Policy and Development at the IOE's Social Research Institute. Her interdisciplinary research focuses on issues on international development, especially on inequalities, violence, displacement, and social factors influencing health and well-being of young women and girls. Dr. Kelly Dickson is an associate professor in evidence-based mental health and an integrative psychotherapist in clinical practice, also based at the Social Research Institute. Kelly leads systematic reviews in global mental health and is interested in biopsychosocial factors shaping and influencing people's lived experience of mental health and the implication this has for the design and delivery of complex social interventions. I'm very excited to discuss your fascinating research with you both today, so welcome to the podcast.
Thank you, Marta.
Thank you. Lovely to be here.
So, to begin, how did you both become interested in your respective fields, Mukdarut and international development, and Kelly and mental health?
Yes, thank you. Yes, it has been a long journey. I'm started as a research officer in the evidence synthesis in education and social policy, working across different government departments. But in the last 15 years, I've been, working in the field in terms of international development, working with funders, particularly FCDO or DFID in the past. So we all work, manage, explore different impact of interventions across settings in LMIC, low and middle income countries, and also in humanitarian settings. So my work in terms of context, yes, in looking into the international development, but particularly very much interested in explore the intervention to target or tackle issues for young women and girls or those with disadvantaged populations. So that's my area of interest. So been working with the funder policymakers and users. And in a couple of years, I've been working with local communities and also the World Health Organization as well. So it's been in terms of practice doing that and become more of my research interests.
Yeah, that's very fascinating because it's like you really know how to make impact on your research field, like since you work directly with policymakers, so you work to change, to actually make change in these fields, and it's very fascinating. And what about you, Kelly?
Yeah, so my background is originally in psychology and sociology, and then I wanted to do social research and joined the Social Research Institute. And from there, also doing systematic reviews, firstly in education, but then mental health kind of from personal experience kind of found me, and then I decided to train as a psychotherapist as well, so very much interested in policy and practice, so wanting to be a practitioner. And then at my time at the Social Research Institute, working with Mukdarut in international development and wanting to do more research on actually the evidence base for mental health interventions and bringing in that kind of social lens. So really thinking about how our environment and what we're exposed to might affect and shape our mental health, and how we can support people going through, difficult times in a very practical way. So really thinking about the implementation as well as the kind of effectiveness of interventions, and bringing people's voice in. So, doing qualitative research to really understand what people's experiences of interventions are, and doing that kind of research across different types of mental health programs and in different contexts. So in humanitarian evidence, but also in high income country contexts as well.
That's very interesting. Why do you think it is important, and how important is evidence-informed decision making when responding to the needs of local population when it comes to humanitarian emergencies?
I think it is very important from our experience. We aim to producing high quality, relevant research, and many times the findings or knowledge that we collecting and we accumulating is not translated into the local setting, community. So particularly in humanitarian crisis where the on the ground changing rapidly, it's hard to understand the needs are changing, and that is another challenge in terms of doing research. Because like Kelly saying that we want to understand the community, the needs of local populations, and when the things change so rapidly, I think it's really important to make evidence to, as a researcher, to recognize the challenge in terms of how we're going to make it relevant, possible, accessible to people on the ground and policymakers that make decisions on the ground, timely as well, because I think is very important.
Okay, yeah, I see. And how different are the evidence that you collect depending on the emergency that you focus on? I guess that like you would collect different evidences based on the emergency, the specific emergency that you are studying. So I was wondering what kind of different evidence you collect from different emergencies.
I think, like, based on the previous question as well, so you have, in terms of what is happening on the ground, not just the type of emergency, so the difference between being exposed to prolonged war compared to, the difference to a natural disaster. You will get different types of interventions and different types of approaches to support people. And a big factor in that is sometimes the timing of the intervention. So, one of the things that we were very interested in is when should you intervene? So, not just should you intervene or how should you intervene, like what type of intervention you might support people, but the timing of it, because potentially if you intervene too quickly, it could cause harm. For example, if you have just been exposed to a humanitarian emergency that was like a tsunami, for example, your priority might be your basic security, your health and your well-being and your mental health, and the effect of exposure to that disaster. You may experience symptoms like post-traumatic stress syndrome, but you might not. So if you intervene too quickly, it might not be helpful. So when we were looking at the evidence, we were really wanted to be sensitive to nuance here as well. So people's experiences of war and protracted conflicts can be quite different, and the way that you might want to intervene and the evidence base around that might be quite different. There could be similarities, but yeah, trying to understand the evidence base in terms of what is effective and when it is effective and for who. And that can really help policy to kind of understand, maybe at the beginning of exposure, for example, like the Ukraine war, for example, that it might be that psychological first aid is what is needed. So helping people to understand that their exposure to war is having an effect on their mental health, which might be quite different for in another setting if somebody's experienced displacement or they're asylum seeker or refugee, these kinds of things. So when we're looking at the evidence base, we're really thinking about these contextual factors.
When it comes to mental health and psychological well-being in humanitarian emergencies, what has the evidence shown so far? So, for example, in the Ukrainian situation, as you were saying.
Yeah, no, just to refer back to our work, then the work that we did start in 2015, which is funded by DFID or FCDO through Oxfam. So we looked at the impact of mental health and psychosocial intervention programs are conducted in humanitarian setting, um, in low and middle income countries. We looked across populations. I want to say that also about who is very important as well, because we look across population, particularly separately between young people and adults. So the finding is very interesting. We found a lot of evidence. Basically, many types of interventions start from cognitive behavioral therapies to education to safe spaces. There are different types of way approach to address mental health and well-being. What we found is that in adult is very promising in terms of we found that the MHPSS programs show some kind of benefits to improve functioning and reduce PTSD or post-traumatic stress disorders. Very strong evidence there. Comparing to children, we found evidence quite inclusive. There is kind of variety in terms of the outcomes. We did meta-analysis, means that we bring together different findings from different papers together to see the direction and magnitude of the impact. So you can see that there are differences already in terms of population who you plan to, intervene at the end. So quite interesting. And we just published the paper actually on the impact just 2 weeks ago or 1 week ago in terms of the impact of the programs on children and young people. So that's how we come, to see the differences in terms of impact, like very clear for adults and quite, we need to look further how we can do better to improve mental health and well-being of children in those settings. I think Kelly Works also want a look at the implementation side in terms of how to implement different types of intervention.
Okay. Is there anything you want to add, Kelly, on this?
Oh yeah, so alongside looking at the effectiveness of the interventions, we also look to see what it is about how the intervention is delivered that can support those outcomes. So three key elements are kind of the community engagement. So when interventions are embedded in the community and they are culturally sensitive and relevant to people, then people find them more acceptable. They enjoy the intervention a lot more, and also people who are engaged in the intervention often, regardless of the type of intervention it is, so whether it's cognitive behavioral therapy, whether it's narrative exposure therapy, what they really value is the relationship with the provider, like their trust and the experience that they're having with the mental health provider. There's some evidence that you can be stigma associated with engaging in programs, and so when those programs actually, when they're delivering them, thinking about how they kind of present the program to reduce that stigma, then they're more likely to have uptake, so more likely to have people who want to participate in the program, and that kind of sits alongside that community engagement, so that there is less kind of discrimination or stigmatization in participating in those interventions. And some of the names that we're talking about here, people are familiar with those interventions, in high income country context, and it's very important to think about how those interventions are translated to the local community. So translating the intervention into different languages and understanding the way of communicating with people about mental health, because it is different across cultures. So that's some of the kind of insights that we find when we look at the evidence on how these programs are being delivered to sort of support, like we're saying, support them to be more effective, to achieve the outcomes that they want to achieve.
Very interesting. It's fascinating also, like thinking about how many challenges you have to face in order to structure a good program.
Speaking of the importance of trained providers as well, like when interventions have to be potentially be delivered relatively quickly if you're intervening quite soon, but even without that, just you can train kind of lay providers. So that was as well as having sort of qualified providers, an important part of the delivery mechanisms as well.
Definitely. Have you come across anything surprising or unexpected in your work?
For this one, yes, for the children, the reviews for looking at the impact of MHPSS program on young people and children, we found a trend of possible unintended impact effect of psychosocial programs. Means that the programs use approach like a safe spaces, creative play, sports, less structures in a way in terms of the program theory to deliver to children and young people. And we found there is some kind of possible unintended effect impact in their mental health, particularly on depression. This has come as a surprise, and we try to understand further in terms of what might be the case. And as you say, that could be about the on the ground, that on the unstable uncertainties that children faced at the time. The literature on children's mental health intervention in children, pretty much the majority is school-based intervention, so they're delivered in school. And this creative play and structure is mixed between school-based and at outside school. So there is some kind of interplay in terms of how they delivered the program and program itself in terms of designing. So that's come as a kind of interesting fact.
Yeah, as a surprise to you. Nice. What are the key implementation factors to consider when designing and delivering the MHPPS program is in humanitarian settings?
So we kind of touched on it a bit earlier in terms of what we found, but yeah, the key implementation factors would be the coordination on the ground. So the government kind of buy-in, like the funding of those programs. So understanding the importance of them. So because it can require a lot of coordination between different agencies and actors. So when there's greater government buy-in and collaboration, then they're more likely to be delivered successfully. And again, being sensitive to understanding the way in which the program needs to be implemented within that context and within that population group. So the importance of translating that intervention to that context. So it's not possible to just take something off the shelf and deliver it without thinking about the kind of population and how it will be received by local populations. So that's thinking about cultural sensitivity, religious sensitivity, language, literacy, lots of different elements in terms of adapting that program. And similarly, if something that may work for adults may not work for children and young people, you have to understand what it is about the impact of exposure to a humanitarian context that might be impacting that population and tailoring that intervention to that population group. Again, ensuring that providers are, they are trained to deliver that intervention and that they are supported to deliver that intervention as well. Sometimes providers on the ground may have also been affected by humanitarian emergency. So it's not only that they're trained, but then they have supervision and that they're supported to deliver. And the importance of the relationship that people have with the provider as well. So people who've experienced interventions, they really value programs. They really value that the trust that comes And sometimes the format matters as well. Like it's not always individual one-to-one MHPSS that people want. Sometimes people appreciate the group because they want to have the support of other people who have been experienced similar to them. So yeah, these are kind of factors to think about in the design of programs.
May I ask you what is the biggest challenge that you have faced in delivering this program is? Because there are so many different aspects that needs to be working together.
Yeah, I would say that that would be probably the biggest challenge, and not being just coming in, intervening for 6 weeks and then leaving again, so that you're building up that trust in the community and helping people to understand how what they've been through may be affecting them and affecting their mental health, and therefore it may be beneficial to receive a program.
I also think that it's very important to look at the in terms of who delivered the program as well. In those settings, you might have limited qualified practitioners that need to deliver highly, people who have the very mental health issues, like not just because showing symptoms, but as a mental health disorder. So that's kind of the balancing between who can provide and quality of the provisions and access to those provisions as well. I think also a challenge. I think and linked to very much to the Kelly said the funding, etc.
But I guess it must be very much rewarding as well than like to see how then you realize and you put everything in act. Let's say it must be very satisfying. Okay, so I'd like to hear more about the epicenter and the role that it plays with regards to international development, particularly with systematic reviews. And also, if you could give us deeper explanation for those who are unfamiliar with about what a systematic reviews is.
I can talk about epicenter. So epicenter is evidence for policy and practice and information center, which is, as you said, an expert in conducting and teaching systematic reviews and evidence synthesis. We also been working on not just producing evidence and research on evidence use. So basically, that's how it's come together in terms of evidence informed policy making. So we try to bridge between, generating knowledge, doing evidence synthesis, conducting research, and how the findings can be used and can be accessed to policymakers. So we look at both evidence production and evidence use. So that's as a core of the epicenter with a wide range of evidence users and from department governments in the UK internationally as well, and also UN, WHO, UNICEF, the World Bank, etc. So we very much in the center of evidence informed policy making. And Kelly for systematic reviews.
A systematic review is when you use systematic methods to identify existing research and bring them together to answer a question. So rather than looking just at one study, you're trying to look at least more than one study to see if findings can tell you what the direction of travel is in a particular area. So if you have conducted an outcome evaluation, so an evaluation of whether or not a program has been successful, did it achieve the outcomes it wanted to achieve? When you look at more than one study, two studies that speak to the same question, you start to build a picture of the evidence base, and that's what we call the evidence base. So you're looking for similar studies to answer a question. So in this case, the Department of International Development wanted to know if mental health and psychosocial programs were effective in particular set of outcomes like depression, post-traumatic stress syndrome. And so by being able to look at more than one study, we can build up an idea of that overall effect, the overall direction.
So for us is can answer different types of questions, and we have different tools and methods to answer those questions.
Yeah, it's an incredibly useful technique to gain answer or to have like a clear picture of what is on a certain topic. Definitely, like the best way to learn about something is to search for systematic reviews or meta-analysis to have like a broad idea of what's out there and what is known about a certain topic. What sort of impact has your work had on future projects?
I just mentioned already that a part of evidence synthesis work, we have two stages when we conduct systematic reviews. The first stage is to understand, like you say, try to understand the nature of evidence, the landscape of evidence in general, and what we call is evidence map or systematic map. What we try to do is that is not just redo it again. So, for example, mental health and psychosocial programs, we plan to produce evidence maps publicly that people, audience and user can access to the database online and look out to what type of interventions out there that being implemented and evaluated, what type of outcomes that being measured and investigated. So we plan to produce a map. Looking at evidence itself in this field, we found around more than 50 studies across the types of research studies, study designs for investigating just young people, children and young people. So 50 studies will be online, and we plan to make it, flexible and user-friendly in terms of how to access and understand what typology we use for coding this study. So that's one of the build on what we have done in the past few years to building up collective understanding of evidence in the field. Kelly can talk about her work just submitted on migration.
Okay, yeah. So as Mukdarut said, when we originally did this work, we weren't just looking at the quantitative data on effectiveness. We were also looking at qualitative research that looks at those delivery mechanisms. And as Mukdarut was updating that review, because it's quite a fast moving field, even after a few years, there'll be more studies and that can tell you something. We decided to also look to see if there were additional studies looking at delivery mechanisms. And we decided to narrow the population focus to populations who have been displaced, so moved from their home country to another country, to understand how programs targeting that population, what factors might need to be considered specific to them. And we found another 15 studies. And what was interesting about the literature there, the evidence base there, was that there was a lot more what we call mixed method studies, where people were also collecting data on the implementation as they were thinking about the effectiveness. And so we understand a bit more how kind of people are doing research now to think about the two together, how you're delivering, what you're delivering, and how that brings about the outcomes. And what we found is that there was a lot more consideration to unintended impacts. So currently the delivery of interventions are also thinking about whether or not there are adverse events. So basically the people who have been receiving the intervention, did they report a negative impact, and looking at that at the beginning of the program. So really thinking about the feasibility, so how feasible it is to deliver that intervention. So will it work in this context, or do we need to make some adaptations? And that is very different to when we did the review a few years before, to see those kinds of studies coming in now, and actual program people who are delivering programs making changes before they consider the rollout of that program to broader population groups. So they'll do a little bit of testing at the beginning. But this is not published yet. It's in process at the moment, this paper. Yeah. So for ourselves, we are learning as well about the field as we continue to do research in this area, looking at the studies.
Yeah, of course. I guess so that like it's everything is in development. And what are you both looking forward to do next?
Yeah, keep doing. Yeah. So for me, yeah, we are also part of International Public Policy Observatory, which is looking at evidence to inform decision in the UK. So it's more about not just producing evidence and bring together demands from evidence users and help us to frame the research questions. So I think next one is just keeping innovative in terms of evidence synthesis, how we best to address the needs of users, as well as to try to work with different users as UK governments, international governments. I'm working now with WHO, which I mentioned before, with the World Health Organization, and they have the unit of evidence and impact unit that Kelly and I work on a pilot project to pilot the checklist of institutionalization of evidence-informed policymaking. So they are interesting to look how organization, government departments can embed and routinely use evidence to inform their decisions. So for me, it's very spent time 10 years, more than 10 years, I guess, working on producing evidence. And I think for me, it's a very interesting and in terms of the motivating to work with other sides in terms of how we understand users and policymakers to use what we produce so far. So that I think is try to bring both together in terms of evidence user.
Yeah, that's the best part. And what about you, Kelly?
I think I come with a bit more of a practitioner hat. So I'm very much looking forward to sort of understanding online therapy and how we can scale up services. So I think that we did some research on population level mental health in relation to like COVID-19. And there was a lot of evidence from low middle income countries in kind of resource limited settings in how do you enable mental health services to be available to more people, to have greater reach, and thinking about that in terms of delivery in online and how you can train people much quicker, you can scale up much quicker, and how you can support practitioners to maintain the quality of the mental health service that they're providing. And so I guess for me, it's looking at the evidence base in terms of how it can inform policy, but also practitioners on the ground. Being a practitioner myself, I learn a lot from that in terms of how I can work with people online, and that makes it more accessible.
Yeah, that's very, very important. Like it would help a lot of people to get access to therapy and treatment. And it would definitely support many people who comes from more disadvantaged area. So thanks to both Mukdarut and Kelly, it has really been interesting to get to know you both and all your research. I really enjoyed to understand how all the multifaceted aspect of your research and how many different things you need to take into account to deliver that, like sometimes also go out of your area of expertise. Like you need to take into account many different factors. It's like it really sounds like a big work. It was really a pleasure to be with you today, and thanks for coming on the podcast.
Thank you.
Thank you, Martha.
You can follow Mukdarat on X, the website formerly known as Twitter, at Mukdarat, Bangpan, and Kelly at Dr. K. Dickson to learn more. Some of what we had covered today is also available in the episode's note. If you have enjoyed this episode, we have an archive of 21 past season, so search for IOE podcast to find episodes of Research for the Real World, as well as more podcasts from the IOE. And a quick favor before you go. If you're listening on Apple Podcast or Spotify, we'd really appreciate if you could give the IOE podcast a rating 5-star would be nice if you enjoy the show, and that will help us to reach more people who are interested in hearing about such important work. I am Marta, and thanks for listening.
Research for the Real World is produced by IOE Marketing and Communications and IOE Research Development. The theme music was created by Rob Cochran. Tatiana Sotero Diaz is the series advisor, Amy Leibowitz is the series producer, and Jason Ilagan is the executive producer of the IOE podcast.
Thanks so much for downloading and listening to this IOE podcast.